Hello everyone, my name is Scott Johnson. Let me pose this scenario to you. The scenario goes, your loved one, your husband, your child, your mother, your father, your brother, your sister, these people are struggling to take their last breath. What do you do? What do you do in a matter of seconds to help your loved one? The answer is simple. You call 911. When we call 911 in emergencies, we expect highly trained, professional paramedics to arrive at our homes and provide skills and procedures that in some cases could save the lives of our loved ones. But what happens if they lack the most important skill of all, and that is the ability to perform a high quality patient assessment? Now, if you don't know what a patient assessment is the the paramedic's ability to interpret what they see, what they look at, what color of the skin they see on their patients, what kind of trauma, what kind of injuries do they see, what do they hear, are their lungs full of fluid, do they hear them having difficulty breathing because there's something stuck in their airways, what do they feel, do they feel blood underneath the surface, do they feel broken bones? And in some cases, what do they smell? Sometimes poor smells can be an indication of life-threatening infections. They use their senses to perform systematic exams that allows them to determine what is going on with their patient, what is wrong with their patients. And based on this information, they're able to apply it and administer life-saving medication, perform life-saving procedures. All this is based on doing a high-quality patient assessment. But again, what happens when a paramedic is not good at being able to do a high-quality patient assessment? The answer is simple. Their patients may not fare well. And in worst-case scenarios, their patients may even die. When paramedics go to school, their schools provide them with a foundation of how to do a thorough patient assessment. However, it takes years for these men and women. It takes days upon days, run upon run, years upon years for these heroes to be able to master the skill of the patient assessment. In order to perform a patient assessment, a paramedic must have good communication skills. They must have good observation skills. And they must be able to process information quickly. They must be able to take in all the information, all the data that they are taking in based on those senses of sight, smell, hear, and feel, and apply that information and knowledge to determine what skills to provide their patients. And sometimes these skills must be done and performed in a matter of seconds. Some people would argue that the ability to do a patient assessment is really not all that important. Others would say that the ability to do CPR, to defibrillate patients in situations of cardiac arrest, some people would say that these two skills are the most important skill a paramedic should possess. Others may even go on to say that the most important skill is the knowledge of knowing when to administer life-saving medications. The fact is, paramedics do need to be able to place breathing tubes down someone's throat. They do need to be able to do CPR and defibrillate patients in situations of cardiac arrest. And they do need to be able to provide life-saving medications. I'm not arguing any of these points. But what I do argue is that these skills are more important than a quality patient assessment. If you are unable as a paramedic to do a quality patient assessment, you will not know when to perform these life-saving skills. A paramedic must be able to communicate with their patient. They must be able to obtain vital past medical histories. They must be able to identify the medications that their patients are on a daily basis. The most important thing they must be able to do is they need to be able to recognize when their patients are critical. And they need to do this in a matter of seconds, in the middle of the night, in a rainstorm, in a snowstorm. And they have to do this all so quickly that if they do not have good patient assessment skills, they will fail in doing their job. Paramedics are amazing people. They are true heroes in every sense of the word. And they are able to do amazing life-saving things. But the most important skill of all, the one skill that allows these paramedics, these highly trained professionals, is the skill of doing a patient assessment. Without being able to do a high-quality patient assessments, paramedics become very average. Good paramedics become great paramedics once they have mastered this skill. So let me leave you with this final question. What skill do you think is the most important skill a paramedic should have? The answer is simple. Being able to do a high quality patient assessment.